Okay, thank you guys so much for attending. We are talking about Movember, where you do not shave your mustache. People ask what's going on, and you can let them know, hey, Men's Health Awareness Month, okay? It's all about men's health, not only like cancer prevention and stuff like that, but we also want to touch on suicide as well, prevention, okay? And raise awareness in that regard. So you guys should definitely do this. Let your facial hair grow for the whole month of November, okay? People will notice, especially if you don't have any. So we're going to talk about prostate cancer. Prostate cancer is the second most commonly diagnosed cancer among all men after skin cancer. It's already killing hundreds of thousands of people each year, and those who survive face serious side effects. So a normal prostate, as you guys can see, like the gland, it's pretty much like right underneath your bladder. So like this is your bladder, and then this is the stream, and then you go ahead and urinate out your bladder, and then here's your prostate. It's like around your bladder. That's normal. And then this is one that is like cancerous, and this is in both lobes. As you can see, the stream is really compressed, okay, and it's going up into their bladder. So this person probably feels like they need to urinate a lot more than the other person, average. They probably go to the bathroom way more and take way longer than any person who typically is not having this issue. Okay, so prostate cancer does come in stages. Stage 1, where the cancer is small and it's only in your prostate, that's it. Stage 2 is also only in the prostate, but it can be on both lobes, okay? Stage 3, it's spread to the lymph nodes, and then stage 4, it's spread to other organs. And usually with prostate cancer, it can spread to the spine. So if you know someone who's having like back issues as a male, is older, 60, 70, 80 years old, and they're having just back issues for no apparent reason, you might tell them, hey, go get it screened, don't ignore it, get an x-ray, because sometimes it can be that. So prostate screening, we definitely want to screen before, we want to prevent, we definitely want to screen, and we want to treat things right away, okay? So early detection is always the best detection, right? So you can do a blood test, which is called a PSA, which is your prostate stimulating antigen. And also you can have a digital rectal exam where the provider will, insert their finger into your rectum to touch and palpate the prostate and see what it feels like. A normal prostate is going to feel kind of like the tip of your nose, and then an enlarged prostate might feel like a lemon size, like boggy, like bigger. And then a maybe cancerous prostate might feel like a walnut, hard, nodular. Okay, so the prostate stimulating antigen is literally, yes?
Oh, I was leaving the floor. They didn't see me, I'm sorry.
Sorry. Protein that's produced, it can be like both for cancerous and non-cancerous reasons, that you could have an elevated prostate stimulating antigen, and it's a blood test. It can be done any time of the day, okay? And usually at the age of 45 to 50 years old, the prostate goes through a second growth spurt. So you're going to get a higher PSA level anyways. Okay, so besides that number itself, we got other things to consider. Your age. Typically, prostate cancer starts to show up around age 60s, okay? The size of your prostate gland, what does it feel like? Does it feel normal? Is it smooth? Is it nodular? Does it feel enlarged? How quickly your prostate stimulating antigen is changing. Did we check it in January and it was great, and then now we're checking it today and it's like 3 times the number that it was in January, okay? And then are you on any medication that should be helping your prostate and should actually lower the number? So for example, a very common medication for prostate enlargement is called finasteride. Finasteride should decrease your PSA number. So if you have a high PSA and you're on finasteride, then that's going to raise concern, because it should reduce the prostate size by about 60%. So you shouldn't be stimulating too much, okay? While a high PSA level can be a sign of prostate cancer, there's a number of other reasons that you could have a high PSA, okay? Like a ton of other reasons. So that might be, like I said, the enlarged prostate that pretty much every man goes through around age 50, okay? Or you can have a prostate infection, they call it prostatitis. which might feel like a bladder infection for a man. It might feel like you need to urinate all the time. You might have some burning, tingling discomfort. You know, you might get some body aches, and you might have some like testicular heaviness, but it could be like from actual inflamed prostate. And then other less common conditions could elevate it as well. Like sometimes, like if a person is having their prostate stimulated, that could elevate it, or if they recently ejaculated, that could elevate it as well. So 1 out of every 4 people with elevated prostate level in the blood will have, turns out to be prostate cancer. So the other 3 are not. And everybody that I've sent for testing has not had it. Not to say it doesn't happen. You know, 60s are magic number, but I've had one guy who's 38, prostate cancer. So if you're having symptoms, always get screened. So age-specific reference. So basically, from the age of 40, because we start screening at 40, okay? So 40 to 49, they expect your number, if you're Caucasian, to be 0 to 2.5, okay? And at 50 to 59, they get a little bit more room, okay? They expect you to be 0 to 3.5. At 60 to 69, 0 to 4.5, and then 70 to 79 is 0 to 6.5. Anything above 4, you would see a urologist, and the urologist would determine, you know, what to do. Usually do biopsies over 4 to make sure that it's just completely benign. The digital rectal exam, it is an important way to evaluate, to check and see. I don't like it just because of the fact that it's just not concrete enough for me.
Subjective.
It's very subjective. So maybe the one guy goes and does it and everything's fine, and maybe I'm touching and I'm feeling something totally different. So I like to do ultrasounds myself. So whenever somebody needs like that further step, I'll just send them for an ultrasound. That gives me a lot more information, tells me exact size of the prostate, if it has any nodules or anything, masses or anything I should be concerned about. So I do like to do those. If somebody's like their prostate level's over 3, I just start doing it at that point. And that way I can say, oh look, it looks good. A lot better than me putting my finger, and then later you go, well, you said with your finger exam that everything was great. It's like, well, that's what I felt it was. It's just a little too, I don't like to trust myself that much. And a lot of people actually rely on the blood test and ultrasounds a little more than a digital rectal exam, but they are very well, you know, they do get done a lot. So think about your risk factors for prostate cancer. Okay, so knowing the risk factors for prostate cancer can help you determine if you need to get screened sooner or not. So, you know, your age. Have you had anybody in your family be diagnosed with prostate cancer? Talking about your dad, talking about your brother, okay, your child. Anybody like that directly, immediately related to you. And you want to get screened a lot sooner, okay? And the majority, like I said, found in people 65 and older. Start at age 40. Sometimes you start a little younger, like that one guy who's 38, right? And then you're going all the way up until your life expectancy, like within 10 years. So if you are 80 years old, not expecting you to live longer than 90, so probably can cut off at that point from checking. Race, for whatever reason, African American people are way higher risk of developing prostate cancer and dying from it than other groups. Your family history, like we talked about, first degree relative, father, brother, and son. You're really, especially if you have had 2 first degree, like say your brother and your dad, you really want to get screened. You want to have a urologist who has you on surveillance and they're screening you on an annual basis. Your diet, are you a person who's eating a lot of fast food, eating a really high fat diet? Do you have a diagnosis of obesity? We're going to talk about testicular cancer. So this occurs usually in younger generation, like age 15 to 35 is more affected, but it can affect babies. It can affect all the way up until 80, 90 years old. So it goes across the spectrum, but more than likely you're going to be in between 15 and 35. So, if, you know, we just kind of talked about that. It's pretty rare though. So normal testicular appearance is there on the left, and then on the right you can see there's the lumps, and like you can just tell it's not quite right. Okay, so signs may include you have a lump or an enlargement on either side of the testicle. You're feeling heaviness in your scrotum. You have a dull ache in your abdomen or groin. You have a sudden collection of fluid in your scrotum. You have pain or discomfort in your testicular or scrotum area. Enlargement or tenderness of the breast, and then back pain. Okay, so if you're having any of those symptoms and it's out the blue and it persists for more than 2 weeks, you should see somebody and get it examined. And like ultrasound for testicular cancer is like 95% sensitive picking it up. So some risk factors would be a person who's like born with an undistended testicle, which we'll talk about, abnormal testicular development, a family history, your age, 15 to 35, and then race. So at birth, sometimes like when they do a testicular exam, a baby boy might just have one there and has retained the other one. That really puts them at risk for developing testicular cancer later on, and also for infertility. And that shows you here. So if you have sons, they should be getting a testicular exam for any sports physical, or if they're having a physical every year, because I've even had it where they've had both descended and then one rescinded. Rare, but of course I've seen it. So you do want to make sure. It can't be, oh, he was fine last year. Get them examined. Okay. So abnormal testicular development can happen when a person's born with like Klinefelter syndrome, where you have XXY chromosome as opposed to XY chromosome. And then they're showing like a testicular torsion. If anybody's ever had that, it's an absolute emergency, and they will go to the emergency room. Usually it's done. It happens during sports, basketball, football, or something where the cord gets twisted. It is an absolute emergency. So do recommend doing a monthly self-exam. If your birthday is October the 15th, just do it every 15th of every month. Okay, whatever day you're born on. You're supposed to examine both sides, okay, rolling and rotating the testicle between the thumb and fingers, all right? If you're feeling anything, you see like one side's up and the other one's down, one's heavier, you're getting fluid retention, you're feeling lumps and bumps, or you have growing pain or pressure, please bring it to your provider's attention. We got to talk about suicide. So we do know that like men are more successful at committing suicide than women, okay? And in recent years, it's been steadily increasing. Okay, so young men and older men are more at risk. So those in between 20 and 24, there's a peak in suicide in that generation. Okay, and then older people who suffer from like loss of loved ones, friends, they feel isolated or ignored, feel like they don't have value or are overly dependent on others, they're at more risk for suicide. Some of the risk factors may be a person who has like a drug or alcohol dependence, or if they have a hard time coping emotionally, they don't have good relationships with people, maybe they don't have a good work history or they don't work at all. They feel isolated, they have nobody, they live alone, they're not able to sustain a meaningful relationship. I mean, that's huge. You know, you think you have your wife, you have your kids, you have, you know, your significant other, and everybody doesn't have that. And they're not able to keep someone in their life. They've been married several times and end up alone, and it's a big deal, okay? Divorced, that's huge. You know, a lot of people might feel like they're a failure when a marriage doesn't work. Relationship breakdowns, a lot of people don't feel that they have a value if they're not in a relationship. A history of physical or sexual abuse, and an imprisonment. So if the kids, you know, like they're getting bullied at school, and kids don't know how to handle stress, they feel their emotions very, very low and very, very high. Maybe they go on to college, they don't know what they want to do, they don't feel like they're going to be successful, and they want to think about ending their own life. Or they're having issues at work, or they don't work. Like I said, losing a loved one, especially to trauma or disease, is huge and a big risk. Okay, mental illness that goes untreated, a lot of time a lot of times men don't want to admit that they're having depression or anxiety or hard time sleeping, or if they are, they're not going to do anything about it because they might feel like their masculinity is being questioned, so they don't want to have to depend on someone to talk to or medication. But just if you're a man or a woman, we're not exempt from these things. There's 14 million people in the U.S. with depression every year, so we should, if you're having those issues and there's help, you got to get help. And if you know somebody who's at really great risk, talk to them, pull them aside, see if they have someone they're talking to, see if they have support or if they have medication and what they need. Befriend them. They might just need someone to talk to sometimes. Okay? And also somebody who might be suffering from a debilitating disease or illness. A lot of times when people get older, they don't have a significant other anymore. The kids are grown. They don't work. They have a cancer or a diabetes that's not controlled. They don't see, they're like, what's the point? I'm in the way. I'm suffering. I could just leave and it'd be easier for everybody. But those who are at risk. We all know people like this. Try to make sure you're in their ear, and if it's you, then get help. Go to your friendly nurse practitioner. Go to your doctor. If you have a plan, I would say you have to go to the emergency room, because if you have a plan and a means to, let's say, carry out that plan, it's an emergency, absolute emergency. Okay. So we talked about depression, especially in older, physical pain, illness, living alone, and feeling hopelessness and guilt. When you're not working and you don't have your significant other and your kids, you got a lot of time to self-reflect. And you got a lot of time to nitpick the things you didn't do right and what you could have did better. And you got a lot of regrets. So those are the people who are going to be at more risk. So definitely not all suicide attempts are successful, right? You got to know the warning signs. Just because you have the warning signs doesn't mean that you're going to just absolutely commit suicide, but it does mean you need help. And it does mean that it's the time to step in. So, doctors, psychologists, psychiatrists, psychotherapists, volunteer organizations, community mental health centers, hospitals, and social agencies. Here we do have the Employee Assistance Program. So I would highly recommend calling them. They're available 24 hours a day, and you can speak with a licensed counselor 24 hours a day. And the number and the cards in the front there. Questions, comments, or concerns?
I don't think so.
Anything? All right. I thank you guys so much for attending.